So when I think about women in interventional nephrology, definitely we are a minority, and we have been, but we are growing, and that's intentional. But when I think back to the early days, it was definitely a little intimidating. But I think I was the fourth woman to get certified in interventional nephrology, hemodialysis, vascular access procedures.
I have joined ASDIN in 2011 during my training in interventional nephrology. As an outside observer of ASDIN, it is obvious that women play at least an equal role to men within the organization.
Joining ASDIN as a fellow little over a decade ago was a defining moment for me. I can still vividly remember my first ASDIN annual scientific meeting surrounded by renowned figures like Dr. Bethard, Dr. Ash, Dr. Wassi, Dr. Nair, and Dr. Agrawal. It was both inspiring and daunting, as I wondered if I would ever achieve the level of recognition they had in the field.
I've been an ASDIN member for 10 years this year, and at first I just attended the meetings. I was grateful for the society because it is an incredible platform for our specialty, but it really wasn't until Dr. Mani Wase was president that I became more involved.
Yeah, so I joined ASDIN, I believe, in 2004. It's been a while. I really made an effort when I became president to get more women involved, and so seeing the expansion of both to our affiliate members as well as more women interventionalists really was a source of pride to me. Really lobbied to get more people involved at a committee level, and worked hard, to ensure that there was a road that was left behind me for more women to come behind. And I'm really proud that Dr. Nair was that second woman. And then, with the incorporation of more women, we started a Women in Nephrology reception.
I personally find the physicality of the work most challenging. This is particularly true in a single operator setting performing 15 to 20 procedures a day.
You see, women, and especially women who are also mothers of young children, are constantly questioned. We're questioned about our priorities, about how serious we are about our careers, whether you're considering taking time off after a child, whether you're going to continue to work in radiation while pregnant, as if these were binary issues. But of course, as in all aspects in life, the answers live in the gray.
At the time, we were all moms, and we were, to attend the conference, we had young children. We would be leaving our children behind and coming to the conferences. And turns out that, and the other two women that I see a lot in ASDIN were Charmaine Locke and Louise Moist, who don't actively do procedures, but are experts in the field of dialysis access. And turns out that a lot of women, we had a lot of similarities, and we all had a rule when we talked that we would never be leaving our children alone for more than 3 nights at a stretch. We would always be checking in on our children while we were in the conference. It was quite intimidating. I would walk into a room and, you could count the number of women in one hand.
I was one of the first female members of ASDIN to achieve certification in hemodialysis vascular access procedures. And along my journey, I have encountered stereotypes and gender bias. Overcoming this has required just hard work and perseverance. The support by the ASDIN Society has been invaluable.
Many women in the professional arena face the challenge of obtaining support from male colleagues. However, with ASDIN, I have been very fortunate in that regard.
Yeah, so I think the role of anyone in interventional nephrology has been, an uphill battle because, our field is full of turf wars, particularly in academic settings. And when women are coming out of those settings, it can be particularly hard to be the only one. For most of the people that I know who have trained in an academic medical center, they're oftentimes the only woman who's training. And it's a bit of a boys' club. That's probably an understatement. And it's really important for people to feel supported. And that can be through their male colleagues or even better to have a woman colleague there who's looking out for you, who knows what the path is that you have to plow forward and can actually smooth things over as much as they possibly can. So I think what we're left with now is, as people continue to develop some interest in interventional nephrology, ensuring that women feel comfortable in the field, that they're getting sufficient time and teaching, and that they're made to feel welcome in what can be a very overwhelming and dominant male area of care.
One of my proudest accomplishments within ASDIN was when my many years of dedication and service to the society were recognized, and I was awarded the ASDIN Distinguished Service Award last year. Never underestimate your ability to achieve great success.
It was so empowering to be in a room full of women who had experienced the same types of things that I had, who were all so successful and so powerful and so incredibly intelligent and poised and beautiful, that it was just as just a member, and at that point as a junior member, it was really inspiring to sit there and look around and think, this is possible for me too. And now I'm the co-chair of the Public Policy Committee, as well as the chair on the Awards Committee while serving as a council member.
Our current president, Dr. Nair, is a woman, and about 50% of the council consists of women. These women, and many other women in interventional nephrology, are exemplary female role models. This alone is an enticement for other women to join the organization and be active in interventional nephrology.
When I think of ASDIN and women, I can't really isolate that it's the women itself, but I think the whole community is like a family, and everybody is watching out for everybody else. Everybody's encouraging everybody else, and we all work really well together as, a family. We might have differences as well, but I do feel that having the support of Moni and Amy in those early years, and then them always watching out for me, and vice versa, and then having the support of all the other leaders really did make a difference. If you really work with passion and enthusiasm and dedication and give it your all, people are there to recognize no one discriminates on the basis of gender.
I was fortunate when Dr. Nair took an interest in my one of my projects, the new catheter left behind. I remember mailing her my presentation. She called me back saying, "You exude enthusiasm." She opened the venue for me. She created a session specifically to fit my topic. That validation was the boost I much needed.
Women in interventional nephrology and ASDIN, I've never thought of women in any different way than I have of men. Clearly, the earliest people working in this area were men, for whatever reason. I'm delighted that more and more women have become involved. I've got 3 daughters. I have great ambitions, very supportive for all women who feel like pursuing their careers and dreams. So it's wonderful that so many women have gravitated to this area.
I envision a future for women in ASDIN to continue to rise to leadership positions and take more active roles in the society. To support this, we need to foster mentorship programs, continue to promote diversity, and advocating for equal opportunities. Overcoming these obstacles involve perseverance and actively participating in initiatives to promote gender equality.
And then when you think about women, I really feel that it's not just women who are friends and who promote each other, but what we also call the hashtag he for she, because we all had mentors who were not women, because there were not that many women. And it's the mentors who really kind of pushed us forwards, even when I find that we tend to be more hesitant about taking on leadership roles, taking on larger roles in conferences. And every time I hesitated, I had someone who pushed me forward, who wanted me to take that chance, who was really rooting for me to succeed.
The first committee I chaired was assigned by the past president, Dr. Agrawal. Dr. Sakoria, now president-elect, chose me to co-chair the last year annual scientific meeting, leading to my role as senior co-chair of the 2024 annual scientific meeting, an honor exceeding my dreams. The support of the ASDIN community has been essential to my professional growth.
I am proud to be one of the women in interventional nephrology and to represent the mission of the American Society of Diagnostic and Interventional Nephrology. And I have been active in different committees and the ASDIN Council since that time.
It never occurred to me to attend the first women's meeting at the ASDIN conference because I wasn't a woman and I didn't get invited and I didn't think I should have been invited. Then I discovered that some guy was on that call and they let him participate, and then they started inviting men to come on board, and I thought that was kind of cool. So I've been attending many of those women's conferences. Try to be an observer, but they keep asking me questions. But no, it's wonderful. They're accomplished and they're smart and they're compassionate.
I found ASDIN to be a very open, very welcoming society, which has given chances to all of us. Like if you think of all the women from those days, we've all gotten into leadership. And that is because we've had the support of the people around us.
A few months ago, I had a 96-year-old woman come in for a thrombectomy, and the entire staff happened to be women. The surgical techs, the radiation techs, the nurses, and myself. And she was ecstatic that she had, quote, been blessed to live to see this day. That's the importance of women in interventional nephrology. For our patients, for ourselves, and for all the little girls who make up our future generations.
ASDIN has been instrumental in helping me to fulfill my promise to my father, who was an end-stage renal disease patient on dialysis, to reach the pinnacle of my career in nephrology and provide the highest level of care to all patients enduring renal disease. Through ASDIN support, resources, and networking opportunities, I have been able to keep that promise, continuously advance my skill, stay updated with the latest development in the field. Sometime when I'm presenting at the podium, I feel as if he were smiling down on me.
Thank you so much.